Hello everyone, in this class we'll learn how to record the blood pressure. The definition of blood pressure is it is the lateral pressure exerted by the moving column of blood on the vessel wall. Conventionally, blood pressure refers to arterial pressure. Before we try to learn how to measure the blood pressure, we'll try to some of the normal terminologies. Systolic blood pressure is a maximum pressure exerted during the systole and it averages between 90 to 140 mm of Hg and it depends mainly on the cardiac output. Whereas diastolic blood pressure is the minimum pressure exerted during diastole and it ranges between 60 to 90 mm of Hg and it is going to mainly depend on the peripheral resistance. Pulse pressure is the difference between systolic and diastolic blood pressure. Mean arterial pressure is the average pressure throughout the cardiac cycle and the average value is around 100 mm of Hg and it is calculated using the formula diastolic blood pressure plus 1/3 of the pulse pressure and it is going to signify the perfusion pressure. Then hypertension is when systolic and diastolic blood pressure are greater than 140 mm Hg and 90 mm Hg respectively. And hypotension is when systolic and diastolic blood pressure are lower than 90 and 60 mm Hg respectively. There are different types of recording blood pressure by sphygmomanometer. So they are palpatory, auscultatory or oscillatory method. The apparatus which are required for measurement of blood pressure are stethoscope, sphygmomanometer, and there are different types of sphygmomanometers that can be used. There is a mercury type and there are aneroid type. Mercury type is more accurate, whereas aneroid type is portable, spring loaded but less accurate. The conventional sphygmometer consists of different parts, that is mercury manometer, arm cuff that is also called as Riva-Rossi cuff, and air pump. So this is how simple conventional sphygmomanometer looks like, and it has got different parts: mercury manometer, and this is the air pump, and this is the Riva-Rossi cuff. Okay, so here you can see the mercury tank. Okay. Mercury manometer is a J-shaped. It consists of a long and narrow graduated tube connecting to a short and wide tube. The graduation in the long narrow tube are 0 to 300 mmHg. There is a division at every 10 mmHg, that is 10, 20 up to 300. Each is subdivided into 5 divisions, that is each division is 2 millimeter. The short and wide tube act as a reservoir of the mercury. Okay. So here you can see this is the short tube and this is the long tube of the mercury manometer. Arm cuff. This consists of an inflatable rubber bag enclosed in linen. The rubber bag is fitted with 2 rubber tubes. One rubber tube is fitted to a metal adapter which forms an airtight joint with the reservoir. The other tube is connected to a rubber pump. Then air pump. It is a simple rubber balloon. It has 2 openings which are fitted with valves. These valves direct the flow of air in one direction. It is provided with a screw which when loosened allows air to escape, and air can be introduced into the cuff by pumping. Then coming to the procedure, make the subject to sit or lie down comfortably. Place the sphygmomanometer at the level of the heart, it's mandatory. Then tie the arm cuff, the deflated one, around the upper arm in such a way that the middle of the rubber bag lies approximately across the brachial artery. The lower border of the cuff should be about 2 inches above the crease of the elbow. Then the cuff should be snugly applied, neither should be too tight nor too loose. how to record blood pressure by palpatory method. First, feel the radial pulse. While still feeling the radial pulse, once you tie the cuff properly, inflate the cuff, raise the mercury column till the pulse disappears. Then raise the mercury column further by 20 to 30 mm of Hg. Now slowly release the cuff pressure by unscrewing till you feel the pulse once again. Note down the recording as soon as you feel the radial pulse, and this gives approximate systolic blood pressure. Note that the diastolic blood pressure cannot be measured with palpatory method. So this is how you record the systolic blood pressure by palpatory method. After tying the cuff, you increase the pressure by pumping the air and you are going to pump the air till the pulse is going to disappear. Then you increase the arm cuff pressure more than another 20 to 30 mm Hg. Then start unscrewing the air pump, and at a point the pulse again reappears, and that point is nothing but the systolic blood pressure. Then coming to auscultatory method, for which initially you feel the brachial artery on the medial side of the biceps tendon in cubital fossa. Then place the chest piece of the stethoscope on the brachial artery. So then increase the pressure in the cuff about 20 to 30 mm Hg above the systolic blood pressure obtained by palpatory method. After that, slowly release the cuff pressure 2 mm per second by unscrewing. The mercury column descends slowly. Initially, there is no sound is heard. As the cuff is deflated, you begin to hear the coruscos sounds. Note the reading in the mercury column at which the sound appears first, and this is called as systolic blood BP. As you go on reducing the pressure, you continue to hear these sounds, and at one point the sound disappears. This corresponds to diastolic blood pressure. So this is how you are going to record the blood pressure by auscultatory method. After tying the cuff, you have to place the diaphragm over the brachial artery, increase the cuff pressure more than 20 to 30 mm of Hg, what you have obtained by palpatory method. So then slowly start unscrewing the air pump. Okay, so at a particular point you will be able to hear the coruscant sound, the tapping sound. At that point, and that point is called as systolic blood pressure. And when you gradually unscrewing the air pump, you can hear the coruscant sounds, and at a point these coruscant sounds, they disappear, and that blood pressure is called as diastolic blood pressure. The coruscant sounds, so there are different phases of coruscant sounds. Okay. So these coruscant sounds, they are heard because of the turbulent flow of the blood. So in phase 1, usually tapping sound appears, that corresponds to systolic blood pressure, and becomes gradually louder and clearer. Phase 2 is murmurish during the next 15 Hg fall of the pressure. Then phase 3's murmur becomes louder, clearer during the next 15 mm of fall of pressure. Then phase 4 is muffling during the next 5 mm Hg, and the phase 5 is called as disappearance of the coruscant sound, and that corresponds to diastolic blood pressure. Okay. So the blood pressure is normally 170 by 70, that is 120 systolic and 70 diastolic. which is to be measured. So when you tie the cuff and increase the pressure above the 130, it is going to occlude the vessel. There is no blood flow, so there are no corrosive sounds. Okay. So when you slowly releasing the blood pressure, at a point, the 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 blocked blood vessel, uh, it gives a jet of blood flow which is very turbulent, and you will be able to hear the corrosive sounds. Okay. And when the blood pressure is gradually reduced, okay, so at a point where the turbulent flow becomes the linear blood flow, which cannot produce the corrosive sound, and so that point is considered as the diastolic blood pressure. Auscultatory gap. The auscultatory gap is seen in some cases of high blood pressure patients. For example, suppose the patient's BP is 210 by 100 mmHg. The first tapping sound appears at 210 mmHg, that is, the pulse also appears at this reading. So then sounds disappear as the deflation continues. The sounds reappear at the lower pressure once again and then disappear at diastolic blood pressure. Okay. So suppose in a hypertensive patient, I mean, if his blood pressure is around uh, uh, 170 mmHg, okay, so if you do not palpate the systolic blood pressure with palpatory method, okay, so you'll not be able to record his true systolic blood pressure. And if you record the blood pressure directly with oscillatory method, okay, so when you increase the blood pressure in the cuff up to 150 mmHg, okay, so then you will be able to record the false blood pressure at 130 mmHg, and for the true diastolic blood pressure at 85 mmHg. Okay. And this happens because during the second phase of the corrosive sounds, especially in hypertensive patient, the second phase of the sounds, they are absent. Okay, so that is why you are recording the false blood pressure in them. Okay, and so this gap is called as auscultatory gap, where there are no corrosive sounds in the phase 2 of corrosive sounds. Okay, so this is the example. The first tapping sound appears at 210, they disappear at 180, again they reappear at 150 mmHg and disappear at 100 mmHg. So in the interval between 180 to 150 mmHg, there will be no sound heard, and hence, so this is termed as auscultatory gap. During this auscultatory gap, you can feel the radial artery pulsation. Then the blood pressure can be reported in this manner. You should report the palpatory method, the systolic and auscultatory method, systolic as well as diastolic in mmHg. So then what is the pulse pressure, the mean arterial pressure also should be mentioned. So there can be some variations in the blood pressure. So the sex plays important. Gender, male will have higher blood pressure compared to females because of the hormones, and the elderly, the blood pressure is high due to the atherosclerotic changes. The emotions can increase the blood pressure because of the adrenaline or noradrenaline rush. Exercise increase blood pressure because of the increase in the venous return, and hormones like adrenaline, noradrenaline, thyroid hormone, they increase the blood pressure, whereas because of the gravity, the blood pressure is always high in the lower limb compared to the upper limbs. There can be some racial variation also because of the dietary factors and weather, and sleep of course is going to decrease the blood pressure because the venous return is reduced. So This is about, how you record the blood pressure clinically and some of the factors which are affecting the blood pressure. Thank you.